Hello, and welcome to Mindfulness for Children, a webcast intended to help the children in your life and you experience the mental health benefits of practicing mindfulness. My name is Clare Tieman. I'm a certified child life specialist and currently a graduate student at DePaul University within their College of Education, studying to be a school counselor. So, what is mindfulness? Mindfulness is the practice of slowing down, being present, and paying attention to the thoughts, emotions, and sensations one is experiencing in an objective, non-judgmental manner. Mindfulness doesn't fix things, but it does help you identify and regulate your emotions, better equipping you to handle difficult or stressful situations, which is a skill we could all definitely benefit from during this time of life in the midst of a pandemic. In this webcast, you will learn about the different stages of social and emotional development in children and activities to help children of any age or developmental level begin to practice mindfulness. There are so many benefits to helping children learn the practice of mindfulness. Mindfulness helps children become more resilient, confident, and able to better cope with life's inevitable challenges. Mindfulness increases a child's ability to pay attention, to absorb new information, and improve classroom performance. Mindfulness improves a child's relational and conflict resolution skills, increasing their ability to connect with peers and engage in fruitful relationships. And lastly, mindfulness helps children identify and process through their emotions, leading to decreased levels of stress and anxiety. In order to teach children mindfulness, to bring about the most benefit, and to establish long-term resiliency skills, adults must be willing to practice mindfulness as well. Therefore, these activities are intended for family use. Just because they're geared towards children doesn't mean that they aren't beneficial for adults. And bonus, by engaging in mindfulness practice, you're not only setting an example for your children, you're also practicing excellent self-care and setting yourself up to better care for your family. There are many aspects that are important to a child's development, but today we are going to focus on social and emotional development in children. And we're going to use the framework created by Erik Erikson to examine the needs of children and how to engage your child in mindfulness at each developmental stage. Erik Erikson was a psychiatrist who developed a theory called the 8 stages of development, in which humans face social, emotional, and relational crises and learn to resolve them positively or negatively before moving on to the next stage of development. While there are 8 stages, it covers the entire lifespan. So today we will just be covering the first 5 stages, covering ages 0 to 18 years old. So stage 1, trust versus mistrust, covers infancy through 18 months old. Developmentally, infants are unable to care for themselves. When babies learn that the adults around them will attend to their needs when they need it, they establish a sense of security and trust. If caregivers do not take care of baby's basic needs, the baby develops feelings of fear and anxiety. Some mindfulness activities that you can do with baby are to connect. Put away any distractions and spend some moments connecting with your child. Look into baby's eyes, smile at them, and speak to them in calm, soothing tones. And stay calm. When baby is upset, do your best to maintain a calm, soothing demeanor while meeting their needs. Stage 2, autonomy versus shame and doubt, covers 18 months to 3 years of age. Developmentally, these are the toddler years. Often referred to as the terrible twos, this is the stage of development where children begin to establish a sense of self and want to exert more control over their lives. By aiding your children in building a sense of control and accomplishment over some of their daily tasks, putting on their own shoes, having them help with simple chores around the house, and understanding that your child testing the limits is an important and normal developmental milestone, your child will begin to build a healthy sense of self and discernment skills. Some mindfulness activities that you can do with your toddler are to name those emotions. The more information that children have to label the feelings that they are experiencing, the easier it becomes to identify a proper response and move on from that moment. Talk about those emotions when you're not in the thick of them. Equip your children with the tools before the meltdown so that it's easier to venture into that mindfulness space when faced with conflict, and gently remind them of what they know. Walk through it with them and label those emotions if they don't yet have the language skills to do so. For example, you are sad because your toy broke. I'm sad too. It's disappointing and I'm sorry you're feeling sad. Would you like a hug? Or to go for a walk? Or find a different toy to play with? Name your own emotions and state what you're going to do to help yourself re-regulate. I'm feeling frustrated. I'm going to go sit on my bed and take deep breaths until the angry feeling in my chest feels more calm. Children are naturally curious and will emulate behaviors that they see the adults around them doing. And lastly, put down distractions, the phone, the laptop, the TV, the tablets, and be present with your children. Read, play, color, have conversation, and focus on them and whatever the two of you are doing together. Mindfulness doesn't have to be sitting and focusing on your breathing. Remember, mindfulness is being present in the moment and focusing on something. This is a clip from the show Daniel Tiger on PBS, and I put it at this point in the presentation because I think it can be helpful for children in stage 2, autonomy versus shame and doubt, and the next stage that we're going to talk about, stage 3, initiative versus guilt, children 3 to 5 years old. It's a brief video talking about the importance of taking a deep breath to calm and center yourself when you're feeling frustrated. Stage 3, initiative versus guilt, covers the ages of 3 to 5 years old. Children begin to notice their peers, showing a stronger desire to play with and not just alongside other children. This stage is a continuation of the process of determining one's self and autonomy. Children engage in lots of pretend and imaginative play and are curious about the world around them. Parents and caregivers who discourage trying new things or are controlling often end up instilling a sense of guilt or that they are a nuisance in the child. Caregivers who encourage their children to explore and try new things within safe and reasonable boundaries help children have a more confident and established sense of self, and children are more willing to take initiative when trying these new things. Big things at this stage are learning how to connect with their peers, how to come up with solutions to problems that they face, and how to make good decisions. Some mindfulness activities that you can do with your preschooler or young child are belly buddies. Have your child pick out one of their stuffed animals and lay on their backs, placing the stuffed animal on their belly. Have them pay attention to how the animal moves up and down to the rhythm of their belly breaths. Eat a snack. While you're eating, turn off all other distractions. Notice the size, taste, texture, smell, and appearance of the food that you are snacking on. And lastly, do a 3-breath hug. While giving each other a hug, take 3 big, slow breaths together before letting go. Like the Daniel Tiger video that we watched previously, this video on guided imagery is at this point in the presentation because I think some children in the initiative versus guilt 3 to 5 years old category, as well as children within the next stage that we're going to talk about, industry versus inferiority, covering the ages of 5 to 12, can benefit from some guided imagery. This is a way for children to calm down and center themselves when they are feeling stressed or overwhelmed. Stage 4 is industry versus inferiority, covering the ages of 5 to 12 years old. School-aged children are largely affected by their peers and teachers in this stage. Free play that your children engaged in when they were younger often shifts to more goal-oriented, result-driven play. For example, no longer engaging in as much imaginative play and moving into the world of board games, Foursquare, and sports, learning to work together and in teams. Through schoolwork, children learn skills of self-discipline and time management, and children begin paying attention to the spoken and unspoken social rules amongst their peers. They begin to recognize their strengths and weaknesses, and the strengths and weaknesses of their classmates and peers. It is in this stage that they develop a sense of industry or ability when they do something well, and inferiority if they feel that they don't quite measure up to the standards that are laid before them. Walking alongside children at this age includes helping them navigate those difficult feelings associated with failure and finding a balance of modesty with the things that they're good at and acceptance that they can't be good at everything, and continuing to encourage them to try new things and explore their interests. Some mindfulness activities that you can do with school agers is make a mindfulness jar. Fill a jar with water and a spoonful of glitter, or glitter glue, or rice, or beads, or anything that you have at home. Shake the bottle and have the children notice how everything is swirling around when the bottle is shaken. It's hard to keep track of or notice details about what's in the jar when it's all moving. Then, talk about how much easier it is to observe the characteristics of what's in the jar when the objects have settled. Use this example to talk to children about how, just like the glitter in the jar, when your thoughts and emotions are swirling around in your head, it's hard to make sense of everything and make good decisions. But if you take time to let your body and your mind settle, it's easier to take a closer look at what you are feeling and experiencing and decide what you need to do. The next activity, Starfish Breathing, actually has a video on the next slide because similarly to the other videos that we've watched so far, this is an exercise that I think is great for children within the 5 to 12 year age range, but also can be really helpful for the next age range of 12 to 18 years. You can play the game Highs and Lows. It can be done anywhere, on the car ride to the grocery store, when you're sitting around the dinner table, when you're out for a walk. Have your children name 3 good things from their day and 3 not so good things. As you talk about their good and bad moments from the day, reflect on their abilities to have space in their hearts and heads for both the good and bad. By being aware of their feelings, they are able to feel a complex range of emotions and understand that it's possible and okay to feel both happy and sad at the same time. And lastly, play the heartbeat game. Help children place their hands on their chests to feel their heartbeats. Have them notice how fast or slow it is beating and how their body feels at that given moment. Then, have your children run in place or jump up and down or do jumping jacks before again feeling their hearts. Have them notice how their heart is beating faster and how their body feels after the activity. Starfish breathing is a great exercise to help children be more aware of how they are breathing and to center and calm themselves. The last stage that we're going to talk about today is stage 5, identity versus role confusion, for ages 12 to 18 years old. Developmentally, these are the years of adolescence, and the age-old questions of who am I and what am I going to be are of utmost importance to those going through adolescence. Teens are exploring different identities, becoming more autonomous and independent, and establishing who they are as a person and what they want to be in life. Role confusion occurs when teens are confused about themselves and what they want for their future, or are perhaps not addressing the feelings of what they want that may be in conflict with what they believe the world wants and expects from them, or what they believe their family wants and expects from them. Spending time with peers and establishing autonomy are very important to those going through adolescence. Some mindfulness activities that you can do with your teens. First, just make yourself emotionally available for your teen. Put away distractions and engage in thoughtful conversation. Make family time part of your weekly routine. Talk to your teen about the benefits of mindfulness and how it can help them cope with difficult or stressful situations. And check with your school's counselor or social worker to see if they have any mindfulness programs available for your children. There's a simple exercise called the RAIN exercise that I will expand on a little bit more in the next slide, as well as some apps that are helpful not only for teens, but for kids and adults as well, that I will talk about in the next slide too. You can have your teen go on a mindfulness walk, where you just go for a walk without your phone. You pay attention to the sounds that you hear, the things that you see, the sensations that you experience. Is it raining? Is it windy? Is it cold? Is it hot? And just be very present in that moment. And the best thing that you can do is to do it with them. There's always a chance your teen won't want to engage in mindfulness activities because they are teens. It's okay to set firm boundaries such as no phones at the table or no screen time after 7 p.m. And if you engage in these expectations as well, it becomes less of a punishment and more of just a family expectation. Even if they don't want to participate in these mindfulness activities with you, seeing that you are taking time out of your day to fully listen to them, to be attentive, to take time to calm and center yourself, well, you may just be planting a seed of self-care skills that will help them later on in life. So as I explained on the previous slide, I'm now going to go over the RAIN exercise. Before getting started with this exercise, find a place where you feel comfortable and relaxed. You can do this exercise with your eyes closed, or if it helps for you to journal these things, feel free to do that. So the first letter R stands for recognize. Acknowledge what is happening, just noting it in a calm and accepting manner. A stands for accept. Allow life to be just as it is, without trying to change it right away and without wishing it were somehow different. I stands for investigate. See how it feels, whether it is making you upset or happy, giving you pleasure or pain. Just note it. N stands for non-identification. Realize that the sensations you are feeling make for a fleeting experience and one that will soon pass. It isn't who you are. Two apps that can be very helpful when engaging in mindfulness and in engaging in guided meditations are called Stop, Breathe, and Think and Headspace. These are both free apps and have activities and meditations for kids, for teens, and for adults. The last thing that we are going to talk about is you, the adult. As I talked about in the beginning of this presentation, the best way to help the children in your life engage in mindfulness is to practice mindfulness yourself. The benefits are twofold. It becomes easier for you to manage your stress and anxiety. It makes you more emotionally available for your children. It makes you more centered and more present. Your children will see that in you, and they will want to emulate those behaviors. Some mindfulness activities that you can engage in are some that we've already talked about, such as the apps like Headspace or Stop, Breathe, and Think, or practicing the RAIN exercise that we just went over. Something that you can do to ground yourself is by finding 5 things in the room that you can see, 4 things that you can feel, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. There's also a plethora of resources of YouTube videos and articles and books that you can look up on the internet if you're interested in learning more about mindfulness and about finding activities that might be a good fit for you and for your children. Sometimes people have questions about when they should be practicing mindfulness, and my answer is every day. Do your best to make practicing mindfulness a daily thing in your home. While there are certain mindfulness meditations that are great for bedtime and for settling down, it's best to engage in mindful moments throughout the day and not just when you're tired. And while sitting and reflecting after acting out may be helpful, avoid using mindfulness practices as a punishment for behavior. Mindfulness is most beneficial when it is incorporated into your daily life. So just like you practice fire drills at school so that you reflexively know what to do if a fire happens, practicing mindfulness daily not only helps your overall well-being, but it gives you the tools needed to handle a crisis moment. So to wrap up, there's just a few things that I want you to remember. The first is that mindfulness in children, even young children, is possible and beneficial. Mindfulness helps with social and emotional skills, with problem solving and critical thinking abilities, with academic performances, and it helps decrease levels of anxiety and stress. By engaging in mindfulness, not only are you bettering your mental and emotional health, but you are helping the children in your life become more resilient and capable of handling whatever it is that life throws at them. Thank you so much for listening to this webcast. The next slide will have a complete list of the videos and resources mentioned throughout today's presentation. Again, thanks so much and have a great day.